So we know that some vaccines are in the country, and effective 2nd of March, some listed persons will begin to take the jab. But what must we know about this vaccine? Let's have a conversation on the back of that report filed by Manuel Cranting. Professor Alfred Yorsing is head community health with the University of Ghana Medical School. Good morning to you, Prof.
Good morning.
Great. Also joining us is Dr. Paul Usodro. He's a public health analyst. Dr. Usodro, a very good morning to you as well.
Good morning, Mama, and good morning to our viewers.
Okay, great. Let me start with you, Dr. Usodro, because I understand that there's a research that's been carried out, some kind of study on the vaccines. Can you explain?
Can you take it again? Research carried out on these particular vaccines or what?
Exactly. I understand that your outfit has done some kind of work on this, and I wanted to understand exactly what you've carried out.
We are in the process of carrying out a survey. I think we're almost done with everything. Just we need to roll it out. What we basically seek to do is a fact-finding mission to know whether people will take the vaccine or not.
Dr. Usodro, unfortunately,
what will inform their decision if they won't. So,
Dr. Usodro, can you just go back a bit because we lost you? The line was not very clear.
Okay, am I on now?
Yes, you are.
All right, good. So what I was trying to say is what my outfit is doing in collaboration with faculties from other institutions. It's basically a fact-finding mission to know whether people will take the vaccines or not. And then if they will take, reason why they will take, if they won't, reason why they won't. The reason being that we don't expect this to be the last pandemic. Vaccination is ongoing. Vaccine hesitancy is quite common among some people. So we basically want to know so that we arm ourselves for future vaccine deployment, and then it will also be a good information for vaccine developers to know what the people expect, and then in the course of production, they will engage them so that by the time the vaccines are rolled out, all conspiracy theories and doubts would have been cleared so that community entry will be quite smooth.
Okay. So when can you share details of that survey carried out?
I am sure in the next couple of weeks, we should have enough data to be able to let the public know what the Ghanaian population thinks about this COVID vaccine and then what they would have done differently in order to boost confidence and then let them accept to voluntarily participate in this vaccination exercise.
Okay, but are there preliminary outcome?
No, as I said, we are yet to roll it out, but the questions actually are quite exhaustive. I mean, it will look at reasons why people won't take, reasons why they won't take, so that in moving forward, it will shape the public discourse, and then the stakeholders will know what to do in order to boost the confidence of those who will decline the vaccine, and then see how they will all come on board to be able to help us fight this pandemic.
Okay, great. Prof. Yorsing, let me come to you on this vaccine. From your end, what do you know about it that you can share?
Thank you very much. Because the COVID-19 is a typical infectious disease, we have put in place several measures to contain the pandemic. And one of the weapons in the arsenal that we can use to fight an infectious disease is a vaccine. And therefore, the effort started, and God granting us mercies, we have now got vaccines that fortunately have also come to our country. As my colleague said, there are a lot of issues with vaccines. Rolling vaccines out anywhere comes with a lot of misinformation, mistrust, and all that. But the truth is that vaccines do work. And in the fight against infectious diseases, vaccines play a major role. So we are hopeful. And it's gratifying to know that we have another weapon as we fight against the pandemic. And the AstraZeneca vaccine is one of such. There are a lot of issues that have been raised about the different strains that's coming up and whether the vaccine will be able to deal with all that. For now, we have our scientists in the University of Ghana who a few weeks back did the sequencing and told us the predominant strain that we have in Ghana is the UK variant, which fortunately will be susceptible to the vaccine, or the vaccine will be able to work against. And in terms of public health, population level things, for example, flu vaccines, jabs that are given annually elsewhere, you always look for the dominant strain that is likely to cause the most difficult problems and deal with it. So for now, we are quite comfortable that these AstraZeneca vaccines will do us a lot of good. And as we move on, we will still continue to put in all the measures, especially as we are doing at our borders, to prevent the importation of other strains that may create problems. But for now, our major strain, as has been described, is the UK strain, and we believe this vaccine, as much as possible, will be able to protect and reduce the onward transmission from person to person. And so with time, the rate of transmission of the infection goes down, coupled with all the measures that we need to take. I must also emphasize that the coming in of the vaccine does not mean we will stop all the things we are doing. Even after taking a vaccine, we will still need to wear the masks, we will still need to keep our distance, we will still need to do the hand washing until such a time that at the general population level, we know we have gotten to a point where transmission is quite low, and then we can relax on some of these things. But this is not the time to relax. We still need to put everything together with the vaccine and still continue the fight.
Dr. Paul Owusu-Oduro, let me come to you next on this vaccine that we've received in our country. We know there are some categorized groups that will be taking the 600,000. It won't obviously go to all of us. But typically, what happens? Typically, what would we begin to see in the next few days, as we've been told that from 2nd of March, we will see persons who have been tabled taking the jab? Kindly unmute so we can hear you, sir.
So as has been announced, from the 2nd of March, we expect persons who are eligible for this vaccination exercise to begin taking their jabs. For the AstraZeneca jab, each person will need 2 shots. So the 600,000 doses basically translate into 300,000 people getting a complete shot of the vaccine. I am not too sure if all the 600,000 is going to be given to individuals, that's 600,000 people from the start, or it will be earmarked for just 300,000 people. I am saying this because when you look at I think the Pfizer one or so, when it was deployed in some part of Europe, the second tranches was a problem. And it is important that we stick to the dosage regimen of the manufacturer. The manufacturer says 21 days after the first jab, you take the second jab. It's important we stick to that. So a lot of thinking will have to go into this to know how many people will have to start in order not to break the regimen that the manufacturer recommends we do. But as Prof. Yosin said, the arrival of the vaccine doesn't mean we are out of the woods yet. We typically know that for us to at least be ahead of the virus, we need what we call the herd immunity. And technically, you need about 70% of the population to be immune for you to say that as a country, as a population, we have some level of protection, and for that matter, we are ahead of the virus. With vaccine hesitance, and mind you, not all categories of persons have been cleared to take this vaccine. We know that persons under 16 years can't take this. Pregnant women, the safety hasn't really been established in pregnant women, so they are also exempted, unless in those instances where the risk of taking the vaccine in a pregnant woman will be lower, considered as, in comparison to the benefit that the pregnant woman stands to gain. So all these things will have to come to bear as we roll this vaccine out. Also, what we know is the vaccine protects against symptomatic illness. It doesn't mean that those who get the vaccine won't catch the virus. If you catch the virus, the vaccine wouldn't make you fall sick severely or critically for you to be hospitalized or put in ICU. But there is a possibility that you, the person who is protected, you can still have the virus and pass it to a susceptible host. So even if we take the vaccine, we still have to follow the preventive etiquette that we've known all this while in order to make everybody safe.
Professor Yosin, there are questions that children are beginning to ask, and I shared this morning how my 9-year-old was asking why we're giving only adults for now, we're not giving children, and why they still have to wear the mask even after they've taken the vaccines. They're very basic issues that we haven't quite dealt with. How do we begin to explain to our younger ones?
Great. I think the whole educational base of the population on the vaccine has not been top-notch. We need to educate the public well, and as you are saying, some of these things, the school children need to know. So it is important, I agree with you. We need to continue the engagement and educate them. And as my colleague said, once we start vaccinating the adult population, and then we are able to attain a certain herd immunity, it's like creating a barrier. You know, I always say that for the adults, we should behave well in order to protect our children. Therefore, the vaccine is another way of helping us to do that. The trials that were conducted in the manufacturing process of the vaccine did not include children. And therefore, at this stage, we wouldn't want to put any child at risk. And therefore, we need to explain to them that it is for their own safety for now. Once adults are protected, then we know by and large our children too will be protected. As we also said, the vaccine will not prevent transmission of disease from one person to the other, but it will prevent severe illness. And that is good enough, because in our adults, parents who have underlying conditions who may be more susceptible, when they are protected and also keep the safety protocols, as much as possible, we will be able to protect the other members of the population.
Professor Yosin, let me ask, Professor Yosin, sorry, let me ask before you continue. So the vaccine is not preventing you from contracting the disease?
Once you get the vaccine, before you come into contact with the virus, what the body does is, even when you get in contact with the virus, the body will be able to fight against the virus. In some limited cases, the virus may still be able to come out as overt disease. But in many cases, it will be subclinical. You might not even recognize that you have the virus, you have the disease, because the body soldiers are strong enough to deal with it. Now we don't have that. So when the virus gets into the body soldiers are not able to fight it. So a lot more people would then progress from infection to become overtly ill or diseased and may become severely ill or critical. What the vaccine does is that it primes the body, prepares the soldiers ready. So as soon as the infection or the virus gets into the body, they are able to fight as much as possible, reduce the damage it will cause, prevent it from becoming overt disease. A few may pass through, but as you say, it will help prevent many becoming critically ill, showing a lot of symptoms and being severely ill as well.
Okay.
So that is what the vaccine is going to do for us.
Okay. Let me bring into the conversation Dr. Michael Owusu. He's a virologist with KCCR. Doc, a very good morning to you. Thank you so much for joining us on this conversation. So just some quick questions specifically on the vaccine. Does the COVID vaccine give you COVID? Well, unfortunately, we just lost Dr. Michael Owusu there. We're going to raise him again. Dr. Michael Owusu, if you can hear me, good morning. Hello, Doc. Okay, I'm not sure we have him. It looks like we lost him again. We're trying to raise him so we can ask some specific questions related to the vaccines. But of course, I've got my two other guests also on this conversation who are joining us via Zoom. So maybe I can go to Dr. Paul Owusu. How do we begin to, I mean, what kind of conversations must we have? We've heard about the fact that we're taking in so much of the vaccines. 600,000 arrived in the country yesterday. The group of people who are supposed to take the vaccine, we know the president will be the first to take it to assure every Ghanaian that these vaccines are safe. But what kind of conversations must we be having around the vaccines?
One question. There has been a lot of conspiracy theories surrounding the virus and then the vaccines. Let me backtrack a bit. The question you were trying to get Dr. Michael Owusu to answer. A COVID vaccine will not give you COVID because of the technology that is used in producing the vaccine. The traditional vaccines, I mean, that were being produced those days, uses either a live organism, that is the pathogen that causes the disease, or a weakened form of that pathogen to make the vaccine. So once that vaccine is introduced into you, depending on how your body responds, it may overcome your immune system and then establish an infection. But looking at the technology that is used in producing this specific COVID vaccines, you take just a portion of the coronavirus genetic material, and then you insert it into another virus which is unable to cause disease in man. So that virus which is unable to cause disease in man delivers that genetic material of the coronavirus to the human cell. And because it is alien to the human cell, the immune system will recognize it and then mount an immune response against that. So you are not introducing an entire coronavirus into the body for it to cause an infection in case the body's immune system is unable to mount adequate response against that. So it is unfounded that the COVID vaccine will let you get a coronavirus infection. It is not true.
Okay.
Now, as I said, because of the conspiracy theories, people are a bit hesitant to take the vaccine. So this is where public health persons, we need to come in and then assure the public of how safe it is and all those things.
Okay.
For a vaccine or any new treatment that comes out, it has to go what we call, it has to be taken through what we call the clinical trials.
Okay. Can I just, apologies there, I'll come back to you, but let me just quickly, because we've now gotten him on the phone line before we lose him. Dr. Michael Owusu is a virologist with KCCR. Dr. Owusu, good morning to you. Thanks for your time. Thanks for joining this conversation. I think that...
Good morning.
Okay, great. I think my earlier question, I probably will have to ask you this because that's been answered. How effective is this AstraZeneca vaccines that are here in Ghana?
Well, they are effective. According to the data, we are doing between 62 to 70% efficacy. And this is within the context of the dominant variant, which is the B117 variant that we have. It's good to understand that the vaccines that we have are all developed within a certain context. As at the time that the AstraZeneca was undergoing through the preclinical trial phase, it was only the prototype B1 strain that was used, both experimentally and also in the lab. So as at the time it was done, this is the 70% that we got. But luckily, through what we call, by collecting blood samples from those who took the vaccine and testing it against the UK variant, they also saw that it is able to at least knock off or destroy the UK variant viruses that come in. So at 70% threshold is what we know about this AstraZeneca vaccine. But as I said, this is within the UK variant and all other B1 and A1 variants that are circulating the system. From South Africa, we know that that particular vaccine is not able to work against the South African variant. But of course, if your country has a predominant strain being the UK, you are better off going for it and then hoping that there could be a re-engineering of these vaccines to allow us to have ones that will cover these South African strains and other emerging strains that may come out in the course of the year.
How different are these vaccines from what we already have in the system? So, for instance, yellow fever, we know that when you take it, it lasts for about 10 years. But this particular vaccine is different.
Yes, I heard one of your panelists talking about live attenuated viruses. So yellow fever is a virus itself that has been weakened. Then it's injected into you, and your body produces an overwhelming immune response that is able to destroy the virus in case you encounter one or you are exposed or it gets into your body. So for this particular vaccine, we don't know, and we have to be humble enough to know that we don't know everything. We know in part, but the other part we cannot tell, which is the more reason why we have to take it. Because as we take it, we understand the FDA is going to conduct an enhanced pharmacovigilance and then efficacy study. So what they did in the trial phase is that after the first dose, your blood sample is collected. After the second dose, another blood sample is collected. And I believe that after 6 months and 1 year, they will still collect blood samples and measure the threshold of antibody levels that is able to make you more immune against this. So I'm sure after a year or two, we will still be having those who have taken the vaccines have their blood sample reanalyzed to see how much of antibodies is in them. If it is at a certain threshold of 70% and above, you still have the ability to fight off or maybe even if you become exposed to it, in order not to become infected. But then if after 1 year it goes down, then of course we may have to think of having something else, booster doses or other things. Like in the case of the US and influenza, every year the influenza virus goes through a shift and drift system in terms of their mutations. So every year new vaccines are enhanced to cover emerging strains of influenza. And that is what the US does almost every year. And it looks as if COVID may take us through that trend. Because within a short time, you could have mutations occurring within the region that is used to manufacture the vaccine. So if you have mutations occurring within that hotspot, it tells you that if you develop 1 or 2 vaccines to cover one region, in the next moment, another region may emerge. Then you have to have further vaccines to cover them. So I wouldn't be surprised that every year we may have enhanced versions of vaccines and take them in order to keep our bodies at a threshold level where we will still be able to prevent becoming infected, or even if become infected, prevent severe disease and prevent death.
Okay. Let me go to Professor Yosin. Professor Yosin, in terms of the front line, the people at the front line, we know that they are taking the jab first. They are part of the first group of people who will be taking it. From where you sit, what's the conversation? I know that Dr. Odro's team will carry out some sort of survey, and then we will get to know why people are either interested or not interested. But in terms of the medical field, what are you hearing? Is everybody good to go? Are they excited about it?
Medical personnel are also Ghanaians. They live in the community. They are exposed to the same social influences. But by and large, I think the education is going on, should be enhanced, and then people will be assured that this is safe and has been used. So I think once we begin the process, I don't foresee any major challenges. The health workers will be willing, by and large, to take the vaccine as a demonstration to the rest of the community that yes. And the other benefit of the vaccine, apart from the science of it, is the psychological boost it gives to our health workers, so that you know that at least now I have some level of protection, and therefore you psychologically you become a little more comfortable. It's not that you're going to relax and not put down put up the preventive measures as it were, but it gives you some psychological boost, and that's what we want to do for our health workers and protect them from the severe forms of the disease.
Okay.
So I think by and large we will not or are not anticipating any major challenges as well as the health workers are concerned. They may have their own anxieties, they may have their own fears, but we've seen colleagues elsewhere, UK, US, others, having taken the jab and shown us pictures, shown us how well they are doing. So I think, by and large, we will be comfortable.
Okay. Dr. Paulo Usodro, how important would it be for persons to publicly take it so that the rest of us can watch? How important would that be?
That would be very important for every public health intervention. You need the maximum cooperation of the people in order to make it work. So we say public health is a concerted effort. It is health for the people, not an individual. And the acceptance of every intervention is critical to the success of it. In our part of the world, we tend to believe opinion leaders and then people in public or high positions. So if we see, for example, assuming people think this vaccine is not safe, I've heard commentaries elsewhere indicating that if we take the vaccine, there will be infertility issues. It's a way for the whites to wipe the black race and all those things. Our president, for example, is a black man. So if you see the president publicly taking a jab, it actually boosts your confidence and it makes you a bit more comfortable that this wouldn't kill you. If it will, we wouldn't put our president, in the front of all this.
Yeah.
So it is important these public persons and opinion leaders do that openly in order to boost the confidence of the ordinary person as far as this exercise is concerned.
All right. Just finally, Dr. Michael, also, if you're still with me, I can choose not to take it, right? Oh, unfortunately, we lost him, but this is where we have to end this conversation. So I want to say thank you to you, Professor Alfred Yosin, Head Community Health, University of Ghana Medical School, and Dr. Paulo Usodro, Public Health Analyst. This is to be continued, so thank you for now. Thank you for your time. And we have to bring you some show business up next with Kadi.